Good afternoon, everyone. This is the clerk with a courtesy announcement that this meeting is now being streamed live on the internet.
Hello, Don.
Hello.
We can hear you and see you. Welcome.
Thank you.
Good afternoon, Kim.
Good afternoon. Can you hear me?
We sure can. Thank you.
Thank you.
Hi, Amy.
Hi, Jill. Thanks for letting me in.
My pleasure. Good afternoon, Bob.
Good afternoon.
Loud and clear. Thank you. And Frank, would you like to do a mic check?
Hi, Jill.
Good afternoon. Thank you. Hello, Lauren.
Hi, good afternoon.
Loud and clear as well. Thanks.
Thank you.
Hello, Ignacio.
Good afternoon.
We can hear you. Thank you. Hello, Rafaela.
Hi there.
You're all set. Thank you.
Thank you.
Good afternoon, Chairperson Chavez.
Hello. Thanks, Jill. Getting us going.
My pleasure. We can see you and hear you loud and clear. Your clerk today will be Dave Leon.
Excellent.
Recording in progress.
Welcome, Susan. And welcome all. We're going to go ahead and get started. Hey, Laura. All right. So are we already live? Great, we are recording. So I want to welcome you to our Children's Family Seniors Committee meeting for, let me just remind myself, today is the 23rd of September. And we're going to start with a roll call, and we are in the capable hands of Dave Leon today.
Good afternoon. Vice Chairperson Ellenberg
I'm here.
and Chairperson Chavez.
Here, thank you.
Thank you.
We'll now go to public comment, and this is an opportunity to speak to an item that is not on the agenda, but within the purview of our committee, and we'll give each public speaker 2 minutes.
All right, 1 moment, please, while we set the timer. First speaker is Scott Largent. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. Good afternoon, everyone. Scott Largent. The safe parking program that was set up by the city of San Jose for the overflow of the sweep of the Apple encampment was an absolute, it just wasn't thought out properly. It would have been a great site to put the Mexican families that are out in the crash zone right now. There's several other people out there. George is also a war veteran. Catherine, African-American gal that's disabled. She would have been fantastic there. Same with Lloyd, the Vietnam veteran that's out there in his RV. These would have been success stories at a site like that. Instead, they just lumped together a bunch of people and they lagged about a week opening up the facility. And there's only 2 people out there right now. 2. That's what the security person has told me. It's not like I peek over the fence that much, but it's pretty obvious what's going on. It's used more like a storage center right now. And I'm just surprised that we couldn't have something work successfully. I don't understand that. I talked with a lot of the neighbors out there. They just wanted to know who was there, know kind of what was going on, kind of in the loop. This stuff just keeps amazing me that people can't get more organized. This could have really hit it off properly. The neighbors would have been excited about it. The children would have been playing together. Because at the moment right now, these kids are playing in a field. That just seems really wrong that they make this whole journey to America and we put them in fields to play with their children. I don't understand that. I mean, at least we put the woman that had the child in the trailer, we put her into a hotel room, but I would think we would want to keep their families together. They got 4 days left right now, guys. So it just seems like there's no options. So please help. Thank you.
That concludes our request to speak.
Thank you. And I want to just thank our public speaker as well. I'm going to go back to the agenda, and Supervisor Ellenberg, we have a lot of meaty items on the agenda, and I wanted to put a number of things on consent, and I will go slowly to get your feedback. If I could start with the consent calendar. What I would like to do is I'd like to put items 4. I'll read them back through. I just wanted to give you, I'm going to give you the numbers and then I'll go through them. 4, 5, 6, 7, 10, 11, 13, 14, 15, on consent. And then I would like to hear items 12 and 17 together, and then 18 and 19 together. And then I would want to make some comments on them. But first, let me just get your thoughts about that overall list.
I am fine with all of that. I want to make a brief comment on item 14.
Great. Why don't you go ahead and do that now?
Sure. The first part of the comment is just absolutely to thank staff for their good progress in this work. I think I saw Sarah here. Hi, Sarah. I'd like for the next report back on this item to include information regarding what promotion is being done for the the Office of LGBTQ Affairs training for implicit bias and workplace diversity. Given the size of our workforce, 56 county employees registering for that training in 2 years, I think, and I'm guessing you agree, needs to be expanded if we're really going to make a difference. So I'd like that to be addressed in the next report back, or not necessarily the next meeting, but before, no later than the March of 2022 CFSC meeting. Does that work?
Yes, that works for us.
Okay, thanks so much. That's it.
Thank you. And I wanted to say again, thank you to the staff, Sarah, you and your team, or unless it's just you, Team Sarah. And also just make sure that we get a progress report on a biannual basis to this committee and have the next one in 6 months back here. And I'd love to have that respond to Susan's inquiry then.
Will do.
Excellent.
Thank you
so much. And then, so just as a reminder, this would be item 4, item 5, item 6. Item 7 is a report relating to the implementation recommendations from December 2020's Human Trafficking Commission. And I'd like to request that the Office of Gender-Based Violence Prevention prepare an update for the Human Trafficking Commission on November 19th. And if you could coordinate that with my office, that would be helpful. And there is no need for these updates to be agendized at the Children's Family Seniors Committee moving forward. And then for item 11, this is to receive a report from the Social Services Agency Department on employment and benefits relating to our Intern and Earn program. And I'd like to request that when the second cohort of Intern and Earn program completes their internship at the end of this month, that the administration provide an off-agenda report with the updates and lessons learned by the November 2021 date timeline so that we can incorporate those into future opportunities. I want to see if the Intern and Earn staff, if someone can respond to that timeline being appropriate or not.
Supervisor Chavez Rafaela, yeah, definitely we can meet that deadline.
Great, and I know the young people have no shortage of advice, so let's make sure we engage them as well. Thank you.
We are. Thank you so much.
Thank you. On item 13, this is the TAY basic income pilot. And what I want to ask the staff is to come back in December, in the December meeting or November, to the full board with as much data as we have on the success or failure of the program. Because what I don't want to do is have the program end in February, have us look at the evaluation, and then potentially have to restart it. So we either have enough promising data or we don't. And I'd like us to be able to do that before the end of the year. Is that okay with staff? Susan, that works for you too?
Yeah, I think that's a good idea.
The final evaluation won't be in Supervisor Chavez, but we have
that.
Yeah. Okay.
Yeah. I'm sorry. You were going to say. I'm sorry. Go ahead. Finish that thought.
Oh no, I was just saying that the final survey won't be in, so we just would have some midpoint data from from pre-baseline to midpoint. But in terms of the longer term effectiveness of the program, we wouldn't be able to comment on that.
Yeah, and I recognize also that that in some ways that the timeline and the timeline needs to be extended, even if we maintain this as a pilot, along with changing the way we're collecting data. Because my fear is that, like I said, we'll stop the program, then decide to start the program again. And I just think the board should just weigh in one way or another, and then maybe extend the timeline. So thank you for that. And then item the VASC, I'm just putting that on consent because we've been getting some good updates on that. And I think that's all of my issues. So Supervisor Ellenberg, could that be in the form of a motion?
So moved.
Second. And I'll just see if there's anybody from the public who would like to speak on this item.
We have no speakers on this item, Madam Chair.
Thank you. And I do want to say to the staff, thank you for the reports. We actually do read them, and putting something on consent is just, it should be a way of saying thank you to you. So thank you all for all your good work. We're now going to move to item 8.
Pardon me, Madam Chair, I apologize for the interruption. We need to take a vote on that item.
Oh, sorry. Sorry. Thanks, Dave.
It's okay. Vice Chairperson Ellenberg
Yes.
and Chairperson Chavez.
Yes.
Thank you.
Thank you so much. All right. So take 2, we're going to item 8. And this is a report back to receive a report on our SART processing map. And I know this has been a really tough body of work, and very much appreciate all the effort that's gone into this. And Carla, am I turning this over to you?
Thank you. I'm going to try and share my screen, and I'm seeing Kim and Lindsay, which is great. Let me just make sure that I'm sharing and it looks good. Great. Thank you. Thank you, Supervisor Chavez, Vice Chair Ellenberg, and all of the CSFC committee. Today, I'm grateful to be joined by 2 of my partners to share an update on the work. And they're the co-chairs of the SART committee, Lindsay Mansfield with YWCA Golden Gate, Silicon Valley, and Kim Walker, the nurse manager with the Adolescent Safe program. So just as a reminder, the Sexual Assault Response Team, or SART committee, is a group of about 40 different folks who make, most of whom provide direct service to survivors, either through the criminal justice system, medical response, or with our 2 rape crisis centers. We meet bi-monthly with work groups, meeting in between to address big issues like creating and maintaining the sexual assault response protocol and other workflow issues. We assess the impact of state legislation on the work, and we are addressing a data agenda and survivor voice. I do want to take a moment to give a special shout out to Erica Elliott with Community Solutions, who would be presenting with us if she wasn't giving a training right now. She too has been instrumental in the work that we are highlighting today. So tomorrow is actually the 2nd anniversary of the Office of Gender-Based Violence Prevention. And one of my very first assignments was to work with the SART committee on a process map and time study. It made for a very long November and December and January, as a small team of us met and manually pulled about 100 cases to review. We reported to you on our first time study in early 2020, and basically what we found was that we really need to do better at bringing in the survivor voice, and we need a database that is safe and secure and works with all the different groups who have a right to know and a need to know information, and a database that can provide us with meaningful, accurate, aggregate data for the public information and for future time studies. So I'm now going to turn over to my colleague Kim to talk more about the status of our database efforts. Kim?
Thank you. So as you can see by this graphic, the data flow between the SART partners is complex, and the database being developed will transition our current paper medical reports to electronic reports. Next slide. Though it's complex, this data is essential for us for a variety of reasons. First, it will help all of us who are providing direct service to a sexual assault survivor by increasing the ease and efficiency of critical data for each individual client or survivor. It will also make possible the aggregate data that we need in order to provide reports that the Office of Gender-Based Violence would be able to post and make available, share publicly, and to guide our work in the identification of trends and patterns that will better inform analysis and the needs for gap response. Good news is that negotiations have concluded and that we're preparing for final review and agreement and signature of the execution of the contract with the single source provider. And we're on course for execution of the agreement by October 1st, with implementation to follow closely after.
Thank you, Kim. So let's now talk about the survivor voice. And between January and March of this year, we launched an online survey available in English, Spanish, and Vietnamese with the intention to increase survivor engagement, to gather anonymous feedback from survivors about their experiences with the response system, to identify systemic challenges and gaps, and to hopefully better understand barriers that survivors face when reporting their assault. We are proud of this first step in accessing the survivor voice. We had 112 unique respondents to the survey, and while we were not able to do the focus groups we had hoped to do, we did have 8 unique interviews. It's a good start. I'm going to turn it over now to my colleague Lindsay to share a bit more about the survivor survey.
Good afternoon. Thanks for your time. So as a survivor and now a service provider, this survey project was near and dear to my heart. Some important pieces that I wanted to highlight include the criteria we had for inclusion, which you can see on this slide. The survivor needed to be 16 years or older. The incident had to occur in or have been reported in Santa Clara County. And then this last piece here, which is bolded, shows that anyone with an active criminal court case was not able to take part in this survey. I point that out because it does result in some obvious limitations to the conclusions that we can draw. But with that said, we did have 112 individuals that participated in this online survey. The most common ages were between 18 and 29, 30 to 44, and 45 to 59, with the 30 to 44 being 42% of the people that took the survey. Predominantly women, people that identified as women took the survey, so 84% of the survey respondents. And then in terms of ethnic background, we had 45% people that identified, I should say racially, as white, 31% as Latinx, 19% identified as Asian in terms of race and ethnicity. And then for sexual orientation, we had 70% of the respondents identifying as straight or heterosexual, and then 15% as bisexual. Anything where you're not hearing percentages, it's because they identified into another category. And then we also had people with the primary language of English utilizing the survey. So that was 96%. While we did offer the survey in other languages and we had it accessible in Spanish and Vietnamese, we still found that 96% of the people that partook spoke English. So despite the limitations that I've mentioned, we did have some things that we saw in terms of patterns. Most of the respondents engaged in some part of the county's sexual assault response system, but a third did not. So you're not hearing from the individuals that maybe were in the system but had a court case. I think, again, that's important to highlight. Across all the demographics, something that was really common for not engaging was just the feeling of shame or embarrassment about the incident, which you know is common among survivors. And then while half of the respondents experienced sexual assault 10 or more years ago, a little over half of the respondents did tell someone. So that may have been a friend, a family member. Less than a quarter of the people that participated in this actually reported to law enforcement. So a lot of engagement with people that are in their community potentially, but not necessarily part of the system. And then, as we know and have learned over the years, perpetrator is typically an acquaintance, an intimate partner, a family member, and less so a stranger. And then another takeaway was that an incident generally occurred in the home of the survivor or somebody else's home. So a lot of these incidents are occurring in spaces where people would like to feel safe, but in fact they're not. And I think that was the last takeaway that I had.
Thank you. Thank you, Lindsay. So we did have some key themes that emerged about their experiences from survivors and their recommendations on how we can improve our response. Some are very clear, like the positive impact of advocates and medical staff to keeping a survivor engaged in the process. Other themes light a path for us to explore, particularly around accountability in the community when one does not want to pursue criminal justice paths. I want to highlight a few of the recommendations. Some of what we found It simply affirms what we've known to be true and amplifies our recommendations to focus on changing the narrative and increasing awareness of the reality of sexual violence and the need to increase survivors' access to counselors, support groups, and rape crisis advocates. This is our best path for survivors to heal. Further, we must continue to serve survivors in ways that are sensitive, culturally responsive, and meaningful. Again, while this might not be new information for folks, it's critical to all efforts if we are to inform the way we address gender-based violence, especially sexual violence. So we did increase, or if we ask, did we increase survivor engagement about their experiences with the response system? We did. Did we identify systemic challenges and gaps? Yes, we did. And do we better understand the barriers that survivors face when reporting assault? We do. And this is with our first effort with an online survey, which we acknowledge has limitations. We believe we can do better by integrating feedback loops as victims are receiving services, and the Office of Gender-Based Violence Prevention will continue to work towards this end in partnership with our SART committee. And this ends our presentation, and we are all available for any questions you might have. And
thank you. That's a very calming picture. Thank you, whoever's sharing can. Thanks. So let me start out by saying thank you, and and just as a little bit of background for Supervisor Ellenberg, because I'm just not sure when the last time we heard this, is that one of the reasons that I actually initiated this is that we had gotten feedback from some victims and actually victim advocates about and frankly, Kim, even actually everybody was giving us feedback about how when someone had an incident like this, how did they access services? How long did they have to wait for services? Whether or not the way people were treated along the path, the length of time they had to wait, impacted whether or not they even access services. And services from everything from how you get your advocate to whether or not you have an investigative officer, how long that takes, and when you're able to access the care. And so one thing that I just wanted to recommend, well, two things I wanted to say. One, I really appreciate how far this has gone. Thank you for that. And the report that was attached was really very helpful. One thing that I'm very interested in is I am very interested in getting the report to the SART committee for a deeper analysis, and then a report back to this committee in the next few months. And there are a couple of outcomes that I'm particularly interested in. One is as much as we can, better understanding the qualitative data as we're waiting to get this quantitative data coming our way, because I think it will be easier for us to marry those two together in terms of what kind of next steps should be taken. But the other, frankly, is that I think it is really critical to be able to take a very deep dive along the entire continuum, because I do think that some of the accessibility questions about like why people, the one question about do people just need information? I think that's probably true, but I'm also wondering if there's already a built-in hesitancy to getting help and what that comes from, why. And so in any case, if we could have the SART committee take a dive, maybe poke at some of those questions. And then just on the database, I do want to emphasize that I'm really, really staying focused on the time it takes us to respond. And by the way, this is pre and post incident, because one of the other feedbacks that my office and I get is that when somebody has been in this situation, how quickly they're able to get counseling, how readily available that counseling is, as an example, or that, because we want to look at the whole continuum. Does that sound okay to everybody? And is that clear? That's okay. Okay. Supervisor Ellenberg, I see you leaning in already, so go ahead.
Thanks. I just want to build on that a little bit. Thank you first to the staff, the whole team there for this report. The ledge file indicates that in the next report, you're going to try to amplify the survivor voice, as Supervisor Chavez was referencing, and the findings of this report, as well as to establish actionable next steps to increase voices that are as diverse as the community. And I absolutely agree that we should be amplifying survivor voices and findings. I'm interested to know if you have thoughts now. If not, you're welcome to share it in an off agenda on what your recommendations are on how to enact systems change to embed trauma-informed responses within the system to address the root causes of dysfunction that a survivor perceives through every step of the process. That may be too complicated for a moment's answer, but I suspect that you've been thinking about this as well.
I don't know if Kim or Lindsay want to weigh in. I do know that the SART committee will be continuing to look at this and do the deep dive. That it was really telling. This is just one small example, but from some of the, one of the survivors who noted that they didn't receive certain information and they wished that they had, and it's actually part of the process to happen, but this is a long process and it's a hard process. So it was a good reminder to the folks who are doing this that even if they are doing this as part of their job right at the beginning, this is something that has to be reinforced throughout the exam and at multiple times, the offer for an advocate.
And subsequently too.
Yeah, exactly. And so having those examples, and we did start that review with the SART committee to think about, it's too easy to say, oh, well, this is already happening. It's really about how do we address the fact that people are need to have this reinforced. And so that's just one small example of how we're looking at workflows and ways of bringing this in, and we can have different moments of opportunity to check if the person hasn't been connected with an advocate, for example, at a certain point. Maybe it's time to remind them of this option and see if we can bring it in once again, because that really is a very strong way of linking the survivor to additional resources and the counseling that makes such a big difference for them. So I'll let Lindsay and Kim weigh in, but that's just one small example of how we can do these things.
Thanks, I really appreciate that.
Yeah, I thought one of the big takeaways I had was how many people we had that were responding and an incident had occurred, over 10 years ago. And so some of the things that people may have experienced 10 years ago, I think we've come a long way. I think we always have more to learn and more to do. But I do think, like, in terms of having embedded advocates as part of SEIU and having that requirement, right, to tell somebody what their rights are and what support they can get from the very beginning being built into the protocol. Those things are important. And then having representation from different communities so that when you're going to seek services, you're seeing somebody that you feel maybe can understand you and hear you out. Changing our language so that we're inclusive in terms of gender, sexual orientation, all those things have come a long way. And I think those are really key elements.
Thanks, Lindsay.
I think it's also important that we make sure that as we break down the process and we're looking, to your point, at all of the places where we can build in that trauma responsive care, that we're thinking about how we can make that last beyond us. Because, Lindsay mentioned that 10 years ago, they're talking about their experience. Well, 10 years from now, we might all be in a different place, but we're still going to need to make sure the response in Santa Clara meets the needs. So making sure those policies are solid and that the relationships between the responding agencies are really solid so that we can work together and come up with these plans. But also, I think the takeaway for us is to make sure whatever we do is we're building in the survivor voice. It's so key and so critical.
Clearly. Thanks so much. I really appreciate that you each took a minute to reflect on this work in that way. It's gratifying and it's very reassuring that we have this continuous improvement mindset with survivors at the center. So that's all. Thanks.
Thank you. I think the only other thing is, as you're looking at continuing to do one-on-one interviews, I do think, and I know this is a really hard group to talk to, but I am really particularly interested in speaking with people who haven't ever reported. And I know people that fall in that category. I know everybody probably on this call does. And I would be really interested in because I think any communication we do really has to be rooted in the why people don't. And so I know that's a painful discussion, but one I hope you can dive into.
It's definitely one that we want to, and in fact, it really was because of COVID that we didn't do. The interviews are tough, and we had hoped for some focus groups, and might be able to pursue some of that as well. But we are grateful that 30% who did participate in the survey were people who had not reported.
Yeah.
So, yeah.
And I would say, Carla, probably for some of these, the surveys, the one-on-one interviews might actually be better than the groups anyway, because of the high level of privacy that people may need. So I don't want to discourage you and say, hey, go ahead and do focus groups. If we recommended that, I just want you to know the flexibility is really what it takes to get the data we need to improve the system, right? And that's why the one-on-ones might be more valuable.
Thank you.
Thank you all. Good work. We'll look forward to seeing you in a few months. No pressure. I know you guys are I'm always staring at you. When do we get more information? But thank you. I appreciate you. All right. We're going to move on to item 8. This is just as a reminder that this is a direction that came out of our April 29th joint hearing with the City of San Jose and on gender-based violence. And so if we could, I'm not sure who's reporting on this today. Consuelo, this will be you on the house.
This is item 9,
Yes.
to confirm. Okay.
Yes, thank you. But just as a reminder, out of our gender-based violence committee, we were very interested in how we addressed housing relative to this particular community.
Thank you, Chairperson Chavez, Supervisor Ellenberg, Consuelo Hernandez, Director with the Office of Supportive Housing. And this item fits very well with the summary that Carla just shared with you. We've been working with her and her team on looking at the continuum of housing needs across all gender-based violence populations. So I think it's great that it's coming through that. And, we've been basically leveraging a lot of the partnerships that Carla has created. And we started with this kind of fundamental question that I always start with whenever I'm learning something new about a new program is, if I'm a survivor, walk me through the continuum, right? Very client focused. And through that working group that we've created with Carla and her team is looking at the different types of housing interventions, what the gaps are between those systems, and really try to understand the housing and childcare needs of the broader spectrum of those that are surviving the gender-based violence situation. Supervisor Chavez, if you remember, one of the recommendations that came out of that was creating this work group. So rather than creating a new work group, we basically leveraged Carla Collins' housing work group from the body of work that she's doing through human trafficking. And one of the immediate things that we found through that is that there is a lack of consistent use of terminology and data. And so the first thing that we did is try to understand the need and identify the gaps. So we've now collected all the data, have talked through some opportunities. As you know, there's tremendous opportunity through the state now with Project Home Key, with Ending Family Homelessness. And what we did is we started with a presentation. This is how we look at housing. And it was a joint presentation with the City of San Jose's Housing Department and my team. And we shared the opportunities that exist within our existing shelters, new housing development, and what they indicated to us is that there is a gap in the transitional housing. And so how do we start to create programs around that? This report is intended to be a preliminary report that summarizes for you where we are today and the work that we propose to do over the next few months. We are scheduled to reconvene as a group to identify those opportunities. For instance, with our partnerships across the county, we've identified 5 potential hotel conversions that may be submitted for Home Key. And one of the questions that we've asked the group is, is it more beneficial to have a site-based 100% for DV survivors or survivors of gender-based violence, or should they be scattered across different hotels or different programs? So we're still working through what the ideal model is. But in the report, we share with you in the background section some of the questions that we've asked and what are some of the immediate things that we can do. For instance, what I learned through my questions is in some cases, a survivor qualifies potentially for an affordable housing unit, but they might not meet individually, they might not meet the credit requirement for that unit. But there is an opportunity for us to work with the affordable housing development community to have a reasonable accommodation. And this is what we do in our permanent supportive housing programs, where we basically vouch for the household because we're providing them with the rental subsidy and the supportive services. So how do we create that model? It doesn't require any additional money, if you will, but it's a system and a policy change. And that can happen very quickly. So one thing that we discussed is, should we bring a pool of developers together to problem solve around this? And that doesn't require any action from this committee or from the board. Those are things that we can take action immediately. And that's where we are. Any recommendations that we might develop through this work that require a budgetary ask, we would be proposing that through the budget process.
So Consuelo, just a couple things that that I want to make sure we're really using your time efficiently, and I'm sure these are things you're already thinking about, is that, one is that both Supervisor Ellenberg and I have together been really focused on how we make sure that we don't have homeless families on the street. I know you're going to talk to us about that. I'm really, Susan, very excited to hear what they've unveiled for us on that front. But one of the issues that I have become more and more concerned about, and I think Supervisor Ellenberg, I feel like you and I both raised this in different venues. So Consuelo, I'd love your thinking on this. I am convinced that people stay in abusive relationships of all types to maintain their housing and some consistency for their families. I think that includes sexual abuse, both of adults, but also of children. And I know that when we think about victims of violence, we're thinking about victims of domestic violence, sexual assault, and even human trafficking as a sexual violence. And so one thing I would just ask is that as you're walking us through to look at all the different communities that mirror the community you're already looking at, because I think rather than have us come with each new victim category, I think we recognize that there's the bigger problem we're trying to solve is making sure that frankly, that we don't have homeless children in our community, that we're just going to take care of that. But in addition to that, that we do have this very strong safety net so that folks who are victims of abuse and their children have the opportunity to move on. And I mention that because I know that there's been some really good work done in partnership, Consuelo, with you and Destination Home in terms of restructuring current processes to make sure that we're able to start to address some of this need. What I'm excited about is being able to look at it holistically, but like I said, it may be of value to you just to engage organizations that do all this different kind of work at the same time. And I know that we have partners like Nextdoor that are frankly that are dealing with this issue, Community Solutions, the Y. Because I think those partners might help us think about solutions differently. How do you feel about approaching it that way? I think we've given you like multiple referrals, and I'm trying to see if it helps to pull them together a little.
Thank you, Supervisor Chavez, and my apologies for not being more articulate in that area. And that's exactly why we leveraged the housing subgroup of the work that Carla started. She asked our office to participate in that through the housing lens. And it was very clear from that it's essentially similar needs. In the background section of the report, for instance, we talk about universal design elements that we can think about in future developments, where again, it's work we're already doing, and there are these small changes that make a difference from a perception of safety for survivors.
Yeah, and I apologize. I didn't have a chance to read your report. I know it came a little late yesterday, so thank you. I'll make sure I take a look at it.
But yes, Supervisor, I think exactly what you're saying is how do we leverage this existing network so that we can address the issues holistically.
And I would love to, have this come back with a little more meat on it in the December timeframe, November, December, because the one problem with the budget process is that I think in part because of the ARP funds, I think in part because of the sense of urgency we all have to make sure that the state dollars are spent, that we're competitive for them. I don't think we're going to be waiting until June or even February. I think some of these decisions are going to have to be made along the way. And so, so I'd really like to make sure that you're back in November or December with a framework and a plan. And your point about, about home key and those resources that are available it just reminded me that we're living this out as we're talking. So thank you. Supervisor Ellenberg.
Thanks. Since kids are such a significant part of this population, which is horrible in itself, we really need to be thinking as well about childcare access and facilities adjacent to, close to, or within any of the housing that we're talking about. And I know there are limited things we can do with structures that are already built, converted hotels, but in connection with looking at county facilities and county buildings for where childcare may be feasible, let's think about that in terms also of where we are housing people. And certainly, I know moving forward, we're talking about including a consideration of childcare space in any new permanent supportive housing or affordable housing that we are working on. But we're going to have a pretty immediate need with kids currently. So what do you think, given that we're dealing in many cases with already completed structures, how can we help find support on that side?
Thank you, Supervisor Ellenberg, for the question. We did pose that to the group to try to understand the childcare needs a bit better. And the number one request that they made of us is to make funding available either through existing contracts that we have, but basically low-cost childcare was the number one option that they asked for. And then if subsequent to that, if there is an opportunity to provide that within a facility, like a housing development site, that would be great. But the number one thing is making sure that they have access to low-cost childcare. And
sure.
And so the work plan will include the discussions around that from the needs of people that are participating in our programs. For instance, are staying in shelter or in transitional housing, how we address the childcare needs when they're in that space. That's right. That's when we come back in December, we will absolutely have more details for you around that.
Fantastic. And just to share that access isn't only dependent on cost, although that is critical. It's also on availability of spaces in places that are convenient to the parents. So when we're thinking about access, let's please make sure we're thinking about both, not only affordability, but literally available spaces.
Susan, may I jump in on that topic?
Please, of course.
So yeah, I think what you're saying is so right. And Consuelo, I realize that, that this is a whole new area of expertise that we're asking you to take a look at. And one of the things I'm wondering is if ESA, who's done some initial, I think they had a consultant actually who they hired that did a survey with us. And with the county employees, and I just wonder if we already have resources or a contract that would give you the support you needed to do the outreach. Because I think the point you're raising, Susan, is so right on, which is we really need to talk to actually impacted parents, and probably it would be a benefit to talk to a lot of them in order to get something that is statistically relevant to the way we do planning. And if there's already somebody out there who has that, that knowledge that could actually help, I think would be really great. And then the other thing that I would just add to that, and is that there may be a value in also looking at what's going to be new, because I wonder a little bit about how TK availability may impact parents, including even where we think about shelters, or the interim housing. So I just think that if we already have somebody, so you don't have to be an expert in that too, that may be of value.
Yes, cross-department partnerships are beautiful things. Thank you. Thanks very much, Consuelo. Really excited about the work. Very appreciative.
We'll see you back here, Consuelo. I know November is like a nanosecond away, but I would like to make sure we don't miss any budget opportunities for discussion. So could we make sure this is no later than December, but if you can come back in November, that would be ideal.
Absolutely.
Great. All right, thank you. Thanks for that report. Supervisor Ellenberg, you good? Anything else on that one? Nope. Okay. So our next item is item 12, and we're going to hear item 12 and 17 together. Am I right about that? I wrote all over my notes here. Yes, item 12 and 17, and then we'll go to 16.
Hi, good afternoon, Supervisors. Daniel Little, Director of Department of Family and Children Services. I'm going to be covering item 12. I'm happy to be joined by Lauren Bruder, who's with RDA, that after the presentation can answer some questions about the evaluation. So I'm going to share my screen. All right, so I'll provide a pretty high-level overview of the evaluation itself. Part of the packet today included the full detailed evaluation, but again, Lauren's going to be able to cover if there's questions about that. So the overall evaluation, I'm very excited about this because in my time in child welfare, this is one of the most comprehensive kind of continuum evaluations that I've been part of. So that evaluation is going to look at not only the specific placement components of this new continuum we're building, but really the experience of a youth from the first point of contact with DFCS all the way through permanency, and really aimed at looking at not just the service delivery, but equity related to demographic information and really just the positive impact of the continuum we have. The evaluation is broken up into 4 kind of distinct areas. There's the system-wide outcomes. So that's things like, how many children and families are entering our care, how many children and families are exiting care. The experiential outcomes is going to be items like child and family team meeting experience, their visitation with families. Then youth behavior outcomes, looking at the impact on kind of their mental health, looking at the education support. And placement and transition, something that's come up in the past, really looking at the placement transition process, making sure that we have support during those key transition points, and looking at placement stability. So the evaluation is going to cover quantitative data, interviews, and then focus groups. And then the interviews and focus groups are going to include a broad range of stakeholders. These are going to be DFCS management and staff. The Welcoming Center, specifically for the Welcoming Center component, will be Welcoming Center staff. We'll have caretakers and foster parents as part of this, and then our older youth community. Then specifically around the Welcoming Center, to prepare for that future transition point, year 1 is going to focus specifically on the Welcoming Center. So the delivery of service needs, the enrollment and intake process, placement match. So what happens to a child after they exit the Welcoming Center? Communication and collaboration between stakeholders and placement stability. And I'll say one of the things I'm really excited, again, going back to the full range of this evaluation, is it's going to give us a viewpoint that I don't necessarily have today of the full scope of interventions available to children, and really looking at the changing landscape of the work we're doing and factoring that in. And why I say that is, we've started looking at the number of families that we're serving compared to prior years. And based on the work that our social workers have done, and I think based on the broader prevention continuum we've developed, we've actually brought in around 40% less families this time, comparing this year to last year. And when we look at 2019, it's closer to almost 60%. So we're doing a lot of work around engagement of families early on to make sure that we're serving families in the least restrictive manners possible. And I think that evolving practice will come through in this evaluation. And then the last component is how does this evaluation plan factor into that again, future transition of the Welcoming Center? Two things that I'm going to be looking for in that is, again, what is that optimum staffing configuration for the Welcoming Center, both from an educational standpoint, knowledge and skills, as well as kind of ratios. And then what is the actual program model that we need? How are we going to get what we need out of that type of a program? I don't want to just replicate to replicate. What do we actually need? And I think, again, going to what I just said, with our practice evolving, what are we really going to need in the future sense? And that's just some quick recommendations. Again, I'm going to be leaning on as much of the evaluation as I can to make that recommendation for a transition point, specifically because the state for the Welcoming Center as it stands today has decided that that's a licensed program. So we'll need to have some specifics for a licensure component. And then again, I think this goes into item 17. How does the Welcoming Center fit into the future Center of Excellence? So with that, that's the end of the presentation. I'd like to open it up for any kind of questions.
Thank you very much. I think my main question is, I don't see Dr. Smith here, but I think or it's not even really a question. I guess I have been told, at least I think I have by Dr. Smith, that the Welcoming Center would be part of this Center of Excellence. And so as we talk about the Center of Excellence, I would really like to know how they can be connected. And I think the point you raised, Daniel, about licensure and really looking at this space that we have over there at O'Connor, that we are going to need to make some decisions about what will go there in the short term and the long term, and what should go there from a programmatic perspective. So I wanted to hear them together because I wanted to be able to get feedback on that. And then the other thing that I think is, as it relates to evaluation, I think that all of this has taken such a long time that and we're going through COVID, and I recognize that I'm having a hard time understanding the timing of the evaluation relative to any decisions that the county may or may not need to make, both in terms of the provider and whether or not, and under what terms and conditions, well, not whether or not, when it's brought back in-house and how that works. And then also, does the location have anything to do with that? So could you just speak a little bit to the timing, and then I'll ask Dr. Smith about location.
Yeah, thanks, Supervisor. I think, with the timing, the location piece is something that we'll have to factor in again because of the licensing component. It'll have to be, there's specific facility needs, facility requirements, depending on the licensing component. I do know that we have an off agenda specifically related to the location piece that I think we were going to get some additional specifics to report back on regarding this piece. I think the timing and the evaluation, from my position, the more time I have to see how the program's working, and you're right, it did take a while to get the program actually going. We didn't start accepting youth there until the middle of May. Mm-hmm. The more information we have, I think the more informed the decision can be made on what the program needs to look like. I think we can decide and agree that the future goal is to have the program county run, and the agreement could be that we want it located as close as possible to the Center of Excellence and the Child Advocacy Center. The specifics of that may take a little bit more as we get that evaluation component again to build in, so that we know kind of when we go back to the state, we may say that we want a different kind of program, that they may come back that needs a different kind of licensure. That's kind of the unknown that we're working with right now.
Well, the other thing I would just add is I think it also directly impacts design. I mean, even the physical design. So there's the programmatic design, and then how the physical design of the environment works with what we've learned from the evaluation. Supervisor Allenberg, I see you leaning in.
That's just how I sit, but I do have a question. Thanks, Dan, very much, and to your staff for this work and for the thoughtfulness around building a continuum of care. I appreciated the welcoming center logic model, as well as the mapping of the continuum of care inputs and outcomes, highlighting focus areas of the welcoming center, and family finding services on pages 9 and 10 of the report. I'm generally a big fan of charts and graphs and visual organizations. I noticed in the ledge file that there was a reference to work and conversations on bringing the Welcoming Center back into the DFCS as a center for excellence. We're talking about bringing it internal, which of course was the direction of the board, without creating any potential privacy issues. Can you explain more about what we're thinking that organizational structure would look like?
Yes, Supervisor, I think that's one of the questions that I think we need to determine as we get the evaluation. The easiest answer would be that, the Welcoming Center, if it kind of came back the way it previously operated as a rake, as far as supervision, would be under a DFCS program.
Right.
I think the staff there and what the staffing looks like, that's what I'm hoping that the evaluation component can really highlight.
Do we have concerns about privacy of location? I'm thinking similarly to people who are survivors of intimate partner violence or domestic violence. You don't want to set up a building and say, they're here, this is the safe place to be. Do we have any of those issues around the Welcoming Center or not?
I think that is something that we would need to consider. Similar to what the Child Advocacy Center has to, had to consider doing their lobby and their entryway. That is something that we'd have to factor into the plan. I don't see that insurmountable as a multi-use building. Some of that's going to come back with the state with licensing if there's specific requirements for any kind of a private entry or not. But that is something that we have to factor into the final plan.
Got it. Thanks so much. And I am glad that we're hearing this together with the Center for Excellence, and it is exciting to see movement in that direction. And I'm also very interested to see how it all fits smoothly and purposefully together. Thanks, Dan.
Thank you. And we're going to go on to the next item, and which is item 18. Wait, well, sorry, item 17, our Center of Excellence. And then we'll go to the public. If there are any comments, we'll hear them together. Welcome, Curtis. Oh, you're on mute.
Sorry about that. I was good at that. I haven't done that for a week so far. But good afternoon, Supervisors Chavez and Ellenberg. I'm here. This is Curtis Ohashi. I'm the Chief Operating Officer of Valley Medical Center, and I'm here to provide an update on the Child and Adolescent Center of Excellence. So you have the report that details all of the current updates. In the first section of the report, you can see that we talked about the stakeholders group or the stakeholders forum. We assembled a group of like-minded pediatric service providers and such, and had a formal stakeholders forum on August 3rd. It was a robust discussion. One of the sort of unifying themes and recommendations that came out of the meeting was a need for navigation services. And I think you're both aware that the pediatric service community is a very complex environment, and we typically count on parents to navigate through that complexity, and oftentimes that they are not successful. One of the end goals that we're hoping to come out of the stakeholders group is to develop an advisory group, which we're currently in the process of doing. There have been several agencies have conveyed an interest in participating in such a monitoring group moving forward. The next section talks about the CAC. You can see that they are involved in a couple recruitment activities for a nurse practitioner and PA. And then in regards to the SPARC and the Pediatric Diagnostic Center, as you know, the SPARC Center is already an established service. And so we are currently in the schematic design phase, and their biggest challenge currently is to be able to preserve their current workflows and operations in a slightly smaller footprint than they currently occupy in their downtown location. For the PDC, which is largely undefined, we had several tours with the end users to define space requirements and utilization. From there, we are planning furniture, technology, all those important things, and opening a new clinic. Our goal is to have that schematic design completed by the end of this month and then forwarded on to the architect firm. Several of the entities that participate in the stakeholders forum would also like to have a presence in the PDC. So you will see when we actually release the schematic design, there's a lot of what I call hoteling space. So it's non-dedicated space intended to maximize the optimization of the space by having different entities come in and rotate in on a on-demand basis. There's a little update in the report on the targeted diagnostic assessment volumes, which have increased as they have transitioned over from behavioral health to the various clinics. And then as far as the next steps, we are going to finalize the programmatic requirements, develop a staffing plan, formalize the oversight group, and then again, our completion date on the timeline is July of 2022. And I'll go ahead and pause there to see if you have any questions.
So first of all, I want to welcome Dr. Whitgob. Thank you,
Yes.
I see you there. So just a couple things. One is I'm very excited about the timeline. Curtis, I know you like to meet deadlines, so it makes me very happy that you're playing a leadership role in this.
Yes.
I want to talk for a moment about the programmatic side for the PDSC, and then a little bit about, and we might want to just bring this back as a sub area because it's so new and might be worth us just kind of diving into as a committee. But there are two concerns that I want to raise. One is around design that, I think that one of the most important elements that we're going to be needing to make sure of is that that all of the parties that are supporting the child can meet in a safe, neutral place for themselves. And that really includes the schools, who are such incredibly important partners in terms of what services they're required to provide and the services that they're able to provide, and that we're really, that there's not and I want to say, I don't think when we speak about navigators and case managers, the thing that makes me nervous about that is that often it's a very passive role, which is they give information, and I'm really not talking about that for this system. I really want somebody who is accountable for that child getting their needs met. Like at the end of the day, the way we know that person was successful is the child has access to every program they're entitled to, and period. And that we have enough of communication between the medical side and the schools that there's not an adversarial necessarily relationship between the parent and the schools on behalf of the child, but that we're really able to approach this in a much more robust way. So from a design perspective, my expectation is that that it would be easily accessed by the parent, the teachers, other kind of service providers, and that the medical personnel are able to really be integrated in, not unlike the Child Advocacy Center. That's really the model. And frankly, with the lead agency, the reason I'd like the lead agency to be the county is I think we're really talking about a health-based approach, not just a medical approach, but a health-based approach to addressing these kinds of issues. Thoughts about that?
Well, I have a response, but knowing that Dr. Whitgob is a former school teacher and Dr. Dewan is on the call, and we've had some discussions of how we would interface on the schools, I'm going to defer my answer to them.
Let's see if I'm muted.
You're not.
You're on.
I can hear you.
Okay. Thank you. I want to hear what Curtis has to say too. I think I was just talking to someone today. Oh, Interpreter Services is excited about this. Everyone's excited about this. And I was talking about what's happening, and they were asking, oh, will it be patient navigators? And I said, absolutely. And I see myself as the developmental behavioral pediatrician as one of the prime navigators, because I see the patient. Right now, I'm doing this all from the medical side. And I think our field in medicine is very much health in the broader sense, because we work with schools and all the different services. It's not just pills and medicines. So when the family comes to me, and for a lot of them, yeah, they get the school they need. They get the ABA therapy if they have autism. They get these different treatments. It's great. When it's not, that's when I try and see what else we can do. And sometimes I have some things that work. And next is when I go and talk to these different agencies. And so that's where I see making the connection with when the representative from the school district is at the PDSC. I say, please be here. They're going to be here on Wednesday. And I ask the family, please come in on Wednesday so we can make an appointment for you to talk to the school themselves. And the medical legal partnership is such an important and really useful tool, but they're plenty busy. If we can keep them out of some of these school questions and just get the school and the family and to have everyone feel good about the plan, we can avoid getting the legal system involved. And that's just a quicker solution for the child. So I see.
Absolutely. I think that what I'm saying is that I want to make sure the design of the building is enhanced to make sure that all of the partners, whether, and one thing is, I know that we can meet remotely too. I think we've all learned how to do that. But what I want to make sure of is that that as we're getting children with their diagnosis, that the team is all on board, and that the system that we're using requires meaningful partnership, meaning that when we develop the center, that we're getting MOUs, for example, from all the schools that are participating, that we are really culturally changing the way we provide services to children and families who need them. Because I don't have a single friend who has a child with a disability that is interacting with the schools that has told me that their path was
nope,
really productive for that child. I literally, I don't have and by the way, they're really positive people. So it's not but all of them have talked about their struggles between getting resources from different institutions. And so what I'm really looking for is a design that builds into it the mutual accountability that is required of us to protect these children. So I think there's both a design factor from operations, but there's also a design factor from the way the facility is set up, so that you're right, that there's the County Office of Education has their office, that any high school that's going to be on campus that day, I mean, with us meeting with people, has access to it, that the medical professionals can zip in and zip out, and that we have a convener that everybody agrees is the convener. Now, I'm comfortable with that being the health system, but what I'm saying is that I think we need affirmation from all of our partners. By the way, even the legal partners, I'm not talking about the infrequent folks who do lawsuits, but the folks who are, Parents Helping Parents and other organizations that are already, this is what they do. So, because really, the whole point of this is to help the child as soon as possible. Now, I know you all know that. I'm just saying that the experience with the system doesn't exist like that today. And the whole reason, Emily, I know you came to this from a different perspective than I did, but you and I both came at developing this center, you from your experience internally, from my experience externally. And I want to see a cultural change. That's really, because in the end, that's where we got to get.
These rooms that we have that are already there for the different agencies to hotel in or sit in, I think is also going to be something new, because Parents Helping Parents doesn't necessarily sit next to the school board, doesn't sit next to San Andreas, all in the same place. And if they are overlapping, they can also walk next door and ask a question instead of telling the family, let me call you back in a week when I get the answer. So that's going to be a really big, just sort of like a weaving of all that knowledge in one place as well. And there's room too. I haven't thought as far, but there could also be things at night, if the building allows it, to have more families come after work to hear information, kind of like the Parents Helping Parents workshops that already exist. But they've told me they want to be where the families are, so they will be at the PDSC.
Well, and just as an example, you know, if you look at we're going to need an area for supervised childcare. And by the way, at the Center of Excellence, the one thing we actually should have is a big childcare facility, because it should be a learning, teaching environment. And Susan, that's much bigger than, you know, as we've been thinking about childcare, but I think that is a really great learning opportunity. But anyway, I think as this comes back, what I would want to be able to see is how the design, the operations, the buy-in, and the buy-in, the operations, and the design all linked together to have this really shared outcome of getting to children as early as possible with the services they need. And I think the point you're raising that I really like is I love the idea of everybody being co-located, because I do think that creates mutual accountability. And that's really what we want. And, you know, and like I said, even with our legal partners, you know, they get involved when they feel like they need to, but nobody wants that, right? So Supervisor, I know this is an area you're interested in as well, so lean in.
Yeah, it absolutely is. And of course, I'm in 110% agreement on the importance of co-location and childcare. I want to go back to the parent piece for a minute. We mentioned Parents Helping Parents a couple of times. I know that they're in the midst of some transition right now, and I just want to make sure that there is a specific plan to incorporate parent input into the planning of the center, particularly the PDSC and the service navigation plan. Curtis, are you the best person to talk about what the plan is for how VMC will gather that parent input to inform your planning?
Yes, I apologize, Supervisor. I left that out of my report, but we are having ongoing discussions with P4P because they've done the solicitation of parent family feedback in the past. And so that is part of the plan, and that is in the works.
Okay, great. And if I would be happy to offer some offline, some additional significant parent advocate contacts that might be able to help with further outreach and amplification. And I'm happy to have someone from my team reach out to you and share that as well.
That would be great.
Yeah, thanks so much.
Thank you for that. And, you know, we also have a group of advocates that we've been working with on developing the disability office for the county.
It's the same folks. Okay. Yes. Yeah. Talking about the same people. Yep.
Thank you. All right. Susan, anything else?
No, not on this item.
Okay, well, this is very, very exciting. I'm very much looking forward to the next report back. And I just so appreciate the energy and focus that's going into this. And, you know, one thing I do want to just say is there's not a reflection of childcare at the Center of Excellence yet, but we are going to need to have that come back to us as a discussion. And Supervisor, what I might recommend is that we do a motion on this to have the childcare discussion for this particular facility come back to this committee. And we'll ask Dr. Smith to participate in that discussion.
Thanks. It really is a critical piece, and something that we've heard from constituents too, that, you know, trying to engage multiple children when one has an appointment is virtually impossible.
Right. And there's the supervision, and then there's the actual, like, do we want to put a childcare facility near here? But what I'll just say is we're going to ask for a bi-monthly report back as this launches. So maybe this is September. If we could have a discussion again, let's look at December actually, to give you guys time to get work done, and we'll do a check-in with you in December.
Great, thank you.
Thank you. And Dr. Wickup, thank you so much for joining us.
No, thank you very much.
Yeah.
Appreciate your heart and passion, and Curtis, thank
you. Our whole staff is excited. I was just telling them, and they're thinking, oh, this will finally be a place that is built for us, and the space will be the best to offer their services. And if there can be, yeah, it'll be good. Thank you.
All right, we'll look forward to it. All right, so we'll come back bi-monthly, and then I think we gave enough direction to have that come back to us. Okay, so Now we're going to go to 18 and 19, and this is school link services and the expansion of the school-based behavioral health services. And Supervisor Ellenberg, I want to ask staff to present on both and then to dive into questions. One thing I wanted to just highlight is that one concern I have is that there's no mention of chronic absenteeism at all. And so here's what I wanted to just say, and Supervisor Ellenberg, just to start this out with you, to say this, is that I think that our staff is trying to work on a lot of different things and issues that you and I are raising that are overlapping. And I want to, what I'm hoping comes out at the end of this presentation is that we're aligning all of these requests so you don't feel like taffy, like you're being pulled in different directions. But on the chronic absenteeism as a subset of this work, I'm going to ask for a report back on chronic absenteeism and the plan for that is so that, just because I don't want it to be kind of stuck in here today, it isn't. I read the reports. I get that we're really looking at mental health writ large, and I think if we can align the work being done on schooling services and the school-based behavioral health services as one body of work, then you don't feel like you have to be bent in a bunch of different directions. Supervisor Ellenberg, any thoughts about that kind of broad comment I just made?
A procedural question. I think we skipped 16 on the Office of Children and Families policy.
Oh my goodness, we did.
Okay.
How about, is it okay? Who's reporting on the Office of Children's Family Policy?
Supervisor Chavez, this is Rosalina. I'll report on that.
Oh, okay. So then let's do, if you don't mind, Susan, we'll do 18 and 19 and come back to 16. Thank you so much. I couldn't even read my own writing. I had a lot of arrows. But
I think we care a little bit about that one. Yeah, and that's fine for 18 and 19.
But did you understand the points I was just raising about the schooling services and behavioral health, and just to have them come back as one report in the future and not?
I do.
Okay. All right. I will turn this over to Catherine. Are you and Zelia leading us?
Yes. Good afternoon.
Excellent. All right. Thank you.
Good afternoon, Chairperson Chavez and Vice Chairperson Ellenberg. I'm Catherine Spears. I'm the Program Manager with Schooling Services and Behavioral Health Services Department. I'm here to also share that our panelists are Zelia Faria-Casa, our CYF Director, and Dr. Marianne Dewan, our County Superintendent of Schools. And then we also have here Moretta Juarez, our Deputy Director with Behavioral Health. Item 18 includes a report providing FY21 schooling services, family engagement, and coordinator outcomes, as well as updates to school-based behavioral health programs and collaboration projects, as well as the universal design strategies. And then our item 19 is a report that includes the updates to the expansion of school-based behavioral health services in Santa Clara County. This also ties to our responses from our August 17th board meeting. The projects and the school-based behavioral health resources, the universal design strategies, like you had said, Supervisor Chavez, they're all tying to chronic absenteeism. And so we'll provide that in our report back in October, some additional information regarding our teacher trainings, the district attorney navigation support, and then supports to foster families. So we can go ahead and proceed with any questions that you may have regarding the reports.
Susan's like, let me go. Okay, Susan, go ahead.
You are the chair. It is at your pleasure, but
I get it. This is like, you and I are like, we were made for this committee. And
happy to go.
Yeah, go ahead.
Okay. Several items were outlined to be completed in the August 17th report. Supervisor Chavez and I each asked for several follow-up items. And while these are lengthy reports, and I read them all, and I would make a comfortable bet that Supervisor Chavez read them all too, the core actions that were promised and the follow-up items that were directed haven't been provided. Let me start with page 12 of the report. That indicates that you have begun the process of amending contracts, but agreements have not been brokered with any of the 7 districts that were proposed to add schooling services coordinators, and meetings have only occurred with 2 of the 7 to date. I don't see a framework for ongoing partnership with schools, which Supervisor Chavez suggested, or on an equitable model for co-investment given differences in school district resources has been provided. I appreciated the plan put forward in August, but truly, I'm disappointed, and I'm actually sad because I'm so excited about this work. I'm disappointed to see a lack of urgency in actually implementing the plan that was outlined. Last spring, I indicated that I expected to see both short-term action for the start of the school year and continued effort on the long-term planning. And now with an expected state influx of resources, the planning is really even more urgent. The examples provided on pages 13 and 14 at item 18 illustrate funding makeup of 2 districts. And to me, these summaries underscore the patchwork of funding and the variation across districts. And I would expect this type of analysis would be part of the phase 2 financial planning outlined in the December 2020 report to the board. Let me pause here with an actual question. What concrete steps have occurred to date to plan the phase 2?
So we have been working with our school districts to understand all the different funding sources. And although we showed 2 school districts as examples, we are still having the discussions and data collection and meetings with the school districts to identify what their funding sources are, each level of tier support that they have, and who is the provider within the school district. And then additional funding, what is coming to the school districts, such as the COVID relief funding that came to the school districts or may have already come or is it planning to come to the school districts. How is that being utilized? Mm-hmm. And then understanding too the available capacity that we have in Behavioral Health Services Department, in other programs within our CYF division, and see how we can utilize those programs to also support school districts.
So have actual planning meetings or actions been taken to date between these partners, Behavioral Health, County Office of Ed, Family Health Plan, and Anthem to prepare for the additional state funds through the Child and Family Initiative? I realize that the details on the use of funds haven't been specified by the state yet, but I would think that we should be able to, by now, have identified local needs, agree to what everybody's roles are, review existing resources and gaps, and identify operational issues like addressing workforce needs while we await state guidance.
Yes, so we are planning it hasn't yet been concrete in terms of the plans of hosting convening meetings, but we do have a convening meeting with the Youth Advisory Group for School Mental Health to hear the youth voice about the priorities in which we should implement services or seeing their needs, as well as a community convening meeting to be scheduled in the end of October for school districts and different districts in different county districts to understand the community needs.
You know, I'm really concerned that we are still gathering information about needs. It seems like this has been just such a long time, and we know what the needs are. We had a presentation this morning in the first 5 meeting that I'm happy to send along that very, very clearly spells out the need and the significant increase in referrals from schools and for school-aged children. And I know that I know that I don't have to persuade you that this is critical work, and I know that you want to get to the same place. But I think we must be getting caught up in structural barriers of some kind that is preventing really concrete forward movement. And what I want to reflect on is that I think some of the same themes that come up in our board discussions about the adult behavioral health system are manifest in our children and youth system as well. We have so many strong program components, and that is to your credit and your staff's credit, but they're often siloed, not coordinated, not clear to the board or the public, not necessarily accessible. And the result is that young people can be put at risk unnecessarily, and having these good pieces just isn't enough if they're piecemeal and riddled with gaps. And I was looking kind of for examples of good systems and when this has worked, and thought back to the Children's Health Initiative there, which I think Supervisor Chavez played a significant leadership role in. That program found a way to provide healthcare coverage for kids, regardless of immigration status or income level, with a seamless system on the front end for families, lots of coordinated effort on the back end by county staff to line up eligibility and fill in funding gaps with local investment. And I'm certain that behavioral health is more complicated, but I think that our vision for an accessible system and a true braiding of funding rather than parallel tracks with Medi-Cal and MHSA and school districts and private insurance and other funds really needs to be actively pursued with county leadership. And I'm really directing a lot of this, at least indirectly, to Dr. Smith. Page 8 in item 19 summarizes what has been done as an expansion of school-based behavioral health services. But now, after 2 years since my referral was approved by the full board, the only action taken has been to allocate $2 million in funding. We haven't executed contracts to spend those funds. We haven't brokered agreements with new school districts for SLS supports. We haven't developed a funding plan for expansion of services as indicated as the next step, again, harkening back to December 2020. And as far as I can see, we haven't made preparations to apply the new state resources to gaps in care for the school-based behavioral health system. And I'm trying not to be too repetitive here, but we've got data from the July survey that there are unmet needs. We know that this is a priority of the whole board, certainly not just mine. So let me turn directly to Dr. Smith. What can be done to get this work scaled up in a meaningful way with the urgency that it deserves and with the speed that is so critical to meet these needs? The last thing any of us want to see is an increase in suicide ideation or deaths by suicide. This is beyond urgent in my view. So Dr. Smith, what do you think?
Well, and Dr. Smith isn't in the meeting.
Oh, goodness.
Yes, and what I was going to do is let Zelia answer that question.
Okay.
I mean, Zelia, don't want to put you on the spot, but your hand was up, so I'm gonna let Zelia weigh in. But what my recommendation is going to be that I know Dr. Smith isn't in this meeting because I know he had a conflict.
Fortunately, we're recording, so he will hear. He will hear the questions.
So what I was actually going to suggest is that we should hear from the team, and then what we can do is continue this to our next meeting, and that way we can have a more robust discussion. I wouldn't be asking staff to create a new report, but just allow for a further discussion. But Supervisor, let's let Zelia weigh in and then see if anybody else wants to jump in.
I appreciate that. I do hate to wait another month, so I will be quiet and listen.
All right, Zelia, go ahead. This is your chance. Jump in there.
Good afternoon, Supervisor Ellenberg and Supervisor Chavez. I just wanted to weigh in on a couple different things of where we are since the progress that actually has been made since the August 17th meeting. So in terms of the contracts, they are all in the signature process right now. So we have some that have already been signed and some that will be signed shortly. So all of those contracts will be amended to be able to add the additional funds that we had discussed around the 10% increase to the PI and SLS providers, as well as the mobile crisis response for children who need those services. So those are in process. That does not preclude the providers from actually providing the services, since they do have funds in their contracts. So this was an expansion to the program that will take them through the end of the fiscal year. However, there are plenty of funds in the contracts to be able to provide the services. So there's no impediment at this point for those services to be provided to all children, as we said we would do. Additionally, I wanted to provide an update related to capacity in the CYF system, so the Children, Youth, and Family System of Care, and Catherine has already alluded to this. So we do have our school-based programs, but we have a very robust continuum of care that provides services to children and youth across the entire system. So as of the week of September 12th, so it would have been last week, we had a request for 82 treatment slots, but we had capacity for 149. So we do have capacity across the entire system to be able to respond to the needs of schools. Our providers are community-based, so they can provide services in the community, in the homes, in the clinics, and they can go to schools if necessary.
That's just the Medi-Cal piece, right?
The Medi-Cal piece, yeah. Yes, so the PEI programming is the program that can serve family engagement and PEI, and Catherine can speak more to this, are the two programs that we can address all children regardless of the insurance component. So I just wanted to make those two comments before we moved away from this. And also to say that we have been actively pursuing and trying to engage the school districts in the conversations related to the expansion of the SLS coordinators.
Mm-hmm.
We do feel that the expansion and adding additional coordinators will be a very actually significant step towards coordinating the services. We've already had the experience in the past that without coordinated services, adding services, contracts, providers to schools is actually not effective, because there is no coordination on who's providing what, who's on site, who's seeing who.
I'm sorry, did you just say that the schooling service coordinators that are embedded in districts are not effective?
No. I said what I was saying is that adding services, so adding treatment services, programs to schools is not as effective, I would say, as adding the coordinators. So the coordinators are a first step to be able to expand those services, because without coordination,
agreed.
It's not effective to have all the services there, because, you know, I think it was Supervisor Chavez who made mention of this at one point in this meeting. We don't want providers to be competing, right, to provide services to families and children. We want the services to be well coordinated with the providers who are providing the services to Medi-Cal eligible children, the providers who may be providing services to children who have private insurance.
You know, respectfully, I don't disagree, but we waited so long to reach out to the schools to provide those SLS coordinators. We asked for the plan in April. It came in August.
The expansion.
Yes, we need the coordinators first, for sure. I care at this point less about competition or coordination than I do about actual access. Of course, the ideal is coordination, but in the meantime, if they have no access, that's an immediate term problem.
Right. You know, oh, go ahead, Celia.
Oh, no, go ahead.
What I was going to suggest is that I think I think there are two kind of outstanding issues that from a process perspective that I want to put my arms around, and Supervisor Ellenberg, just see what you think about this. I think one issue is that there's a lot of activity that's in process right now, which is one issue. then there are these core structural challenges that we're going to have. And I think this goes back to the first point you raised about this idea around braided funding and how it's going to be sustainable, how's it going to be equitable, all of those things. And and this report, which is well done, is a subset of that. And so what I want to recommend is that there may be value in us just taking one meeting and workshopping this topic and giving you all, instead of having to do another, and I'm really serious about this, not necessarily another report, but a very structured slide presentation about, the problem we're trying to solve, and then what's in motion in each subject matter. Because I think
and what are barriers? Sorry for interrupting. And how can we help? I know that both of us really want to be useful, not critical. We are partners, and I know that you can all hear my frustration because I am terrible at keeping a poker voice, if that's a thing. But I want this to succeed, and I know that you do too. So let us help. Go ahead.
So I want to pick up on that because I think the barriers are really important. And I also think, Supervisor Ellenberg, that maybe one of the other opportunities is working through Dr. Dewan, that we invite to that workshop the superintendents of some of the school districts, so that we can actually really start to lay out the path, because period. And I think that might be easier, because I think one of the challenges is that while we have read this, I know there's a lot of work you're doing, but we need to be able to both read it, but visualize it, and then be able to discuss what are still the key outstanding issues, because there are a number of them, right? I mean, I think if the school districts aren't responding, we should talk about that. The other thing I'll say that I think from a timing perspective makes a lot of sense to me is that when Supervisor Ellenberg very first asked this question a couple of years ago, it was pre-COVID, but also pre the funding that's now become available at the state, and pre a lot of things. So recognizing all of that, I do think if we could workshop this, it might be a better way of us getting to the impediments that you're talking about, Supervisor Ellenberg. And then there may be other partners too that you all would recommend that we have the conversation with, so some key school districts I think would be ideal. And I think some of our key service providers too.
And our health plan providers.
Yeah. And those, Susan, frankly, on that end, I think you and I are going to have to do some additional work on that I think when we have the plan, then we go to them and say, now you have to help pay. But you're more collaborative. That was a very collaborative way to do it. But actually maybe even VHP, because we get that perspective without, and they work with us, so they're not, we wouldn't be.
Yeah.
I hear you. Okay. Does that sound like a plan? And then Supervisor Ellenberg, what I'll do is work with your office to, without violating the Brown Act, to our staff, to just do the agenda, so that we make sure we get the questions answered that we want to get answered. And then you all give us an update on, based on that, because there's some key questions, but there's also probably information you're working on that we didn't even think to ask you about that is a necessity that gets you to the place we want to go. Does that sound okay as a next step for everyone?
Yes, this is Beretta, Supervisor Chavez and Supervisor Ellenberg, and I really appreciate the idea as in terms of the next steps. And I just really want to appreciate everyone's passion about the work and really trying to serve the youth in our community. So Supervisor Ellenberg, I totally get, what you're trying to say. So I really appreciate your advocacy of the youth in our community. So I think this would be a great next step in terms of kind of organizing in strategizing the presentation, and then bringing some important folks to the table as well.
And
thanks, Brett. I really appreciate that.
No, I just really appreciate the conversation, because I know it comes from the heart. And so, it's really important, because these are the youth in our community, and we really do want to make sure that we can address their needs in a way that is accessible, right? So thank you.
Thank you.
They are our babies.
Yeah.
All of our babies, right?
Yes, all our babies.
Dr. Dewan, I saw you raising your hand.
Yes, I was using my real hand. Just thank you for the conversation and the opportunity, and the recognition that our schools are fairly overwhelmed at this point with the start of school. And yes, we recognize the needs, and we are very enthusiastic about the potential of the new state funding. There are a lot of unknowns about the state funding. Quite a bit of it is going to be one-time funding. And so we do want to be very strategic as partners in how we can blend and braid that one-time funding to build a foundation that can last beyond the state's current investment. So I think the workshop, I'm just offering my support that the workshop idea is the right next step, and to be inclusive of some understanding of the various funding streams and what is going to be within the purview of the county and what's going to be potentially in the purview of school districts, and how we work best together to make that a reality towards new services and more services on campus.
Thank you. Susan, you want to weigh in?
I just want to thank Marianne and thank the entire staff, and appreciate your understanding the passion. And I have a now grown child for whom we needed emergency mental health services, and there's no waiting. This is, when kids need help, they need help. And we know that the needs are so high. And I feel scared. I feel scared when we, talk for years about process and agree on the concept, but are not operationalizing it. That's where this comes from. And I really am grateful to all of you for your work. Thanks.
Susan, thank you for your comments. That's very kind that you shared that. All right. So we have our homework. We'll work with you on figuring all that out. And Moretta, all of you, thank you. And we're kind of the choir here, and we're just trying to figure out how does the choir get in the right order, right? So let's go. All right. Thanks all. We'll look forward to talking to you again. And I'm now going to go back. And I'm so grateful, Susan, that you caught that I missed item 16, which is only, one of my favorite, most important topics ever. So thank you.
Dave would have caught us.
All right, Rocio.
Hi, good afternoon, supervisors. Rocio Luna, Deputy County Executive. This report provides an update on the staffing for the new Office of Children and Families Policy, which I think is super timely given today's discussion. And I'm happy to report that the Executive Services unit expects to complete their interviews for the executive leader of this office by the first week of October. I think the candidate pool is very strong. I'm really excited to have seen that list just very quickly. And invitations for the community partner panel have gone out earlier this week, and it does include a representative from the city of San Jose.
Thank you,
a parent advocate, and of course we're through Dana Bunnett's resources, expansive resources. We're like to have a young person on that panel as well. So really trying to just solidify those panels this week. And we hope to have our candidate by the end of the first week of October. So with that, I'm happy to answer any questions you might have on this item.
Supervisor Ellenberg.
Just a thank you. So having a candidate by the end of October means bringing somebody forward for approval, creating just help me understand what happens after the interviews are conducted.
Yeah,
is there
after
another middle step, or
there may be one middle step. I think I think the panelists working with executive services will determine whether there has to be a second round.
Okay.
If there is, it would be really pretty much on the heels of that. And we hope to have, extend an offer within a short amount of time after that second week. Depending on the candidate that is selected, then of course we'll have to negotiate with them. And of course, there's definitely a sense of urgency to get somebody seated and the right person in this position as soon as possible. And that definitely is, we've heard that loud and clear, and it is a priority for all of us.
Thank you so much.
Yes, and wow, this is one that I'll be singing hallelujah when we get there. And thank you for holding off on the second position so that the new leader can hire their team. So thank you.
Definitely.
All right. Well, thanks for the report. We appreciate
Thank you.
it. And now we're going to go to our verbal reports, and Chief Garnett. Let me see if Laura is around, and perhaps we can go. Oh, there you go.
I am. My video says it was stopped by the.
Oh, I don't know who our magic gremlins are, but if we can undo that.
Fixed.
Oh, okay. Go ahead.
There we go. There we go. Yeah, I don't have much of a report today. I'm happy to answer any questions.
Nothing? Chief Garnett, you got nothing going on?
I got a lot going on. Probably you don't have time to hear it all. No, we're kind of just moving forward on the secure track, and yeah, that's pretty much what we're focused on right now.
Good. And Chief Garnett, one request that I would have of you, if we had been having a discussion at the board on the CSEC contracts. And one thing I would love if you have an opportunity to take a look at that, the way we're proceeding, if you have any thoughts about it. And I don't want to put you in the middle of a hornet's nest, but I just didn't know if you may have a perspective and if you'd had a chance to read the report.
I haven't, and I will.
Okay, I appreciate it. Thank you. We'll now go to Bob Mendecucci. We'll see if he has anything.
Sure. I have a few things. One of the things I wanted to just give folks an update on is a reminder, we're kind of deep in our own work around our system of care, around the child welfare system and such, and a lot of the prevention work that Dan and his team has been involved in for quite some time. But in the background of all of this, there's also this little thing that is the Families First, Preservation Services Act that was passed by the federal government, by Congress back now in 2018. And I just wanted to remind folks that we're due to actually implement this on October 1st, but there's a little bit of a hiccup with all of that at the state level. And to that end, the County Welfare Directors Association with the Chief Probation Officers Association to CPOC sent off a joint letter to the state earlier this week around concerns around the lack of action at the state level. The state is still promising that they will get us the regulations that we need to understand the framework that we're going to be working under, as well as funding that has actually been appropriated. We need the funding. We need the funding to bring in staffing to do some of the work that's required to do what we're going to be doing here in the future. But we're also very concerned around the lack of guidance around the differences between where the state is with its continuum of care reform and the differences required under the federal act. And what we're concerned about primarily is the fact that we have the STRTP settings, as well as the work that we're doing, that we receive some pretty substantial reimbursement for on a monthly basis for kids in care. And if it doesn't comply, the federal government may say you're not eligible for the reimbursement. And we keep pushing the state on these issues, and we really are looking for some closure and some direction on this. My feeling is we will get this probably at the 11th hour, and then they're going to turn to counties and say, well, now you've got what you need, so stand these things up very shortly, by tomorrow. So I anticipate that there'll be further follow-up on this. I think there's a little bit of risk financially. I think we'll probably get to the bottom of that, but we will likely have programs in the system of care across the state that is not in compliance with what the federal government is expecting. There's some provisions around sort of authorized individuals, things that we need to work with our partners in behavioral health around to get established, and we're going to need to continue to work out some of that work. This also speaks a little bit to the work that we're trying to do here in the county and trying to get feedback from the state of really what flexibility do we have. I mean, we're already doing this with our scattered site programs. You know, we're needing the state to tell us how we need to go about doing this work, how we need to license these. And in light of the fact that they're still not clear, I think, in their own vision of what they need to be doing with the Families First Act, it makes moving a system of care forward. And in this even includes some of the conversation just even around the welcoming centers, like how does it all fit in? What do we need to do to license these works? How do we do the planning for this? So like I said, I'm confident we're going to get there, but it's also just yet another bit of the hurdle that we're facing. The other piece of all of this is the prevention work that we're doing. I think we've been charging sort of full steam ahead, you know, under the work that we were doing in the waiver. There's going to be the need to do some shift in our prevention work because the federal law requires that these be evidence-based projects or promising projects, practices. And we don't fully know what's going to qualify as promising even, and whether some of the work that we're doing is going to align with that, and you know, where the state will stand up and basically maybe work with the federal government to say, here's what California wants to do. Maybe we want some flexibility. We want a waiver of that, some of the provisions of that, and negotiate that with the feds. It's all been kind of a black hole so far, but we're still charging ahead with the work that we're doing. But this is also the foreshadowing of we may have to pivot and change a little bit of the work that we do to eventually comply with whatever this framework will be with that. And we're obviously anxiously anticipating this funding that will come to us so we can get geared up and get a few more staff, you know, a few more bodies on board to do the planning around this program. So with that, I'm happy to take any questions.
Thank you. Any Supervisor Ellenberg, any questions? Bob, that's so complicated. And, you know, at some point, it would be good just to get a briefing of what we anticipate the implications are going to be for the county and also for the, you know, for especially because this is going to impact so many transitional age youth and others that are high needs. So we'll look forward to learning more. Thank you.
Absolutely.
Ignacio?
Yes, good afternoon. Ignacio Guerrero, Director for the Department of Child Support Services. What I wanted to do today during my verbal report is give the committee just a really high-level overview of the draft legislative platform that our Child Support Directors Association is currently working on. These are basically 6 key points that they've developed to help guide local county child support agencies in developing their legislative platform in conjunction with their local counties. So I thought I'd share those with you and then see if you had any input or any comments or questions related to that. I'm going to go ahead and start with the first point here, which has to do with funding, not surprisingly. It's providing funding that will allow the program as part of the social safety net in California to reach unserved families and grow the program. Obviously, funding's been an issue for our program in Santa Clara County, so having equitable funding that allows us to serve families is the first point and is key in that legislative platform. The second is to support legislation that actually removes barriers to access the child support program, increases or eases access to justice, and eases operational and administrative burdens to allow the program to work more effectively. Including opposing legislation that can create a barrier to access the child support program for families in our community. The third is to preserve the ability of local county agencies to manage the program under local control. That has to do with the balance between federal requirements and state requirements and local requirements and administration of the program, and making it easier for us to implement those in a way that balances local control and allows us to customize the program to the needs of our community here in Santa Clara County. Fourth is to explore opportunities to increase child support collections directly to families. So looking for opportunities to reduce government recoupment of public assistance that was previously paid for the care of minor children, and instead have that money go directly to families to continue to be an economic self-sufficiency safety net and reduce reliance on public assistance in the future. The fifth point is to expand sharing of information and data between agencies to improve services to families. And that's really focused on collaboration and maximizing services to shared customers among agencies and departments. And finally, the last point is to support legislation that creates, enhances, and preserves the child support program's ability to use effective collection tools and methods. what we're talking about here is the effective use of enforcement tools like intercepts for bank accounts and levies and income withholding orders or wage garnishment. So these are your 6 key points that were drafted by our association. And we'll be reviewing those and developing in conjunction with the county a legislative platform that not only balances some of these key points, but also ensures that Santa Clara County in our program is really prioritizing the use of additional funding and the access to additional funding to help maintain our services in our community. So I wanted to share that. I don't know if there's any questions. I'm happy to answer any you may have. And with that, that concludes my report.
Thank you for that. You know, Ignacio, one thing I would recommend is if you could send that to all 5 board members. And one reason is that those sound really, they sound thoughtful and they sound like that's the right direction. I think that, you know, one area that I'm really interested in understanding is whether or not the tools and methods, you know, as you're all looking at what's most effective, how you get the flexibility at a regional level to do that, and whether or not there is some other partnerships, for example, with the courts, that we could think about that really make it much easier for people to be able to resolve issues with their families. And in particular, I've been thinking about what we've learned during COVID, even remotely. And, you know, I'm hopeful that that partnership with the courts in particular gets strengthened. Not that that's our only tool, but being able to remedy that seems really critical. It feels like we spend a lot of time there and that maybe there's some work we can do around that area. And then the other is, I think that you know, you and I have talked at different times about how the relationship between local government and the state and your office. And so I know when you first came on board, I was really interested in this kind of deeper integration, especially between, you know, SSA and you and all of us. It does seem like the structure that currently exists somehow impedes that. So I'm glad you all are looking at, in a deeper way, kind of diving into how those cross-departmental opportunities could really enhance everybody's work. So I'm appreciative of that and look forward to your thinking on that. Supervisor Ellenberg, any comments on that report? Well, thank you. I want to thank everybody very much. We will see you October 28th, same bat channel, different bat, I think it's same bat time. So thanks all.
Thank you.
Thanks, Susan.
Recording stopped.